This presentation is going to be on cervical cancer. We're going to talk about how cancer is started, um, and then we're going to talk about some specific facts about cervical cancer and how we can prevent it and how we can treat it. First, we want to begin with just a short introduction of who we are. Latinas Contra Cáncer in San Jose is a nonprofit organization established in 2003 to provide cancer education, patient navigation, and psychosocial support to Latino families facing cancer. Our goal is to provide greater access to high quality medical care and connect at a national level to Latino support agencies. So now we're going to talk about how cancer begins, just in general, any cancer, and it all begins in our cells. Every cell, every single part of our body is made of cells. These cells are very small and they pack together to create bigger things like our lungs and our heart and our bones. It's like the clothes you wear, for example. You see a shirt or pants, but when you look really closely, you notice it's actually made of a bunch of little strings packed closely together. Together, the strings make the shirt, and in the same way, all of our cells together make our body. In order for us to keep growing or repair ourselves, such as when we get a cut, our cells divide. They replicate everything that's inside them and divide in half multiple times to make more and more cells. In a single day, 2 trillion cells divide in our body. The machinery that makes our cells work and that allows our cells to keep our body functioning is very complicated, and it's very, very specific and delicate. A small mistake in the division of a cell can make the cell completely malfunction, and if that bad cell stays in our body, it's going to divide and those cells will also be bad. Usually our body, our immune system will kill a bad cell as soon as possible to prevent it from dividing and making more bad cells. But nothing in the world is perfect, and sometimes our bodies don't recognize when a cell is not working properly. And this is what causes all disease. When cells don't work the way they are supposed to work because of an error, that causes disease. In the case of the disease that we call cancer, the problem with the cell is that it begins to divide uncontrollably. The way that our cells know to divide in the first place can be quite difficult to understand, but I think that it is very important that we understand it because this is what causes cancer. So I'm going to try to talk about it in a way that is easy to understand. Basically, there are these 2 guards in our cells that tell the cell it's okay to divide or it's not okay to divide, we are not ready. In reality, we don't actually have guards in our cells. These guards represent certain genes in our DNA, but I will talk about guards because this is easier to visualize. So one of these guards comes from our mom and one from our father. If we lose one guard, it's okay. We can still function because the other guard is still working and keeping everything under control. But when we lose both guards, our cells can't control their division anymore. They don't know when it's okay to divide. They can be full of problems, and usually our guards will stop them and say, wait, we can't divide because we are full of problems. But when we don't have our guards, the cells will just divide no matter how bad they are. This is what cancer is. In cancer, our cells will divide and nothing will stop them because those cells lost their guards. And of course, this can happen anywhere in our body because our whole body is made of cells, which is why there are so many different types of cancer. Pancreatic cancer means that the cells in our pancreas started dividing uncontrollably. Breast cancer means that the cells in our breast started dividing uncontrollably, and so on. Now, some cancers can be genetic and some usually aren't. The way a cancer is genetic doesn't mean that your parents passed you the cancer or that you were born with it. It means you are more likely to get it because one of your parents unfortunately passed on to you a little problem. The reason cancer can be genetic is because you were born without one of your guards. This can be because one of your parents lost their guard during their life, or if they were already born without it, so they couldn't pass it on to you. When you're born without one of your guards, you are at a disadvantage already because only one bad thing has to happen for you to lose that one guard. And without it, there's no control, and then cancer develops. People who are born with both guards have better chances because it is very unlikely to lose both guards during your life. It is more likely to just lose one. And if you only have one, then you can still keep control. So, how can we lose our guards? We can lose them through chance or through environmental factors. This means being exposed in high amounts to radiation, UV light, which comes from the sun, or toxic chemicals. These toxic chemicals can be found in our food, such as through pesticides used in crops, in waste, in alcohol, in processed food, in drugs we are given to treat other diseases, in smoke that comes from factories, and in smoke from cigarettes and other drugs. These things can kill our guards, but that doesn't mean that if you eat an apple that isn't organic and was treated with pesticides, or if you got an X-ray, that doesn't mean that you will get cancer. Our bodies are different and they each react to things in different ways, but being exposed to these and many other environmental factors can cause our guards to die, especially if you're exposed to them for long amounts of time. And so these are the things that cause cancer. The uncontrollable division of our cells causes clumps of these bad cells, which are called tumors. As I said before, once the cell stops being able to control its division, more and more mistakes that will ruin the function of the cell will happen. And these problems will be passed on to the daughter cells through these uncontrollable divisions until the cells in this tumor are completely unrecognizable as the cells they used to be. For example, if this was breast cancer, the breast cells would no longer look like breast cells and they would only work to cause chaos and to turn good, healthy cells into more cancer, like zombies. Now, not all tumors will lead to cancer. Cancer meaning that the bad cells will be so bad that they will cause our body to stop working properly. Some tumors are benign. These can often be removed, and in most cases, they do not come back. Malignant tumors will cause problems in our body. This is because malignant tumors will have cells that will travel to other parts of our bodies. In benign tumors, the bad cells stay within the same area and aren't so far down the zombie route that they are still recognizable as breast cells or pancreatic cells. In malignant tumors, the cells are so monstrous and so unrecognizable that they just cause chaos and they travel through our blood and our lymph nodes to other parts of our body, causing cells there to become cancerous, and that's called once the cancer travels to multiple parts of our body, it is a lot harder to remove. And why is it important to bring awareness about cancer to Latino communities? Because 1 in 5 Latinos in the US die from cancer. It causes more death in Latino communities than heart disease. These are rates that are much higher than in white communities. Latinos are also diagnosed at much later stages of cancer when it is harder to remove than other ethnic groups, causing Latinos to die from cancer at higher rates. This is all because Latino communities are much more likely to be exposed to all the things I said kill our guards, such as unhealthy air, poor diets, etc. And this is because Latino communities in this country are more likely to be low income and to not be able to afford to live in the areas that have good air quality, to afford healthy food, to afford healthcare, or to have access to the education that allows them to know what the risk factors for cancer are and to know what preventative measures to take. So it is important for us as Latinos to understand that these are the disadvantages our community has, that this is the state of our community in this country, so that we can take control of our health and so that we can take the measures that we can take in order to take care of ourselves. Okay, so now we are going to talk specifically about cervical cancer. All the images that are in this presentation are animations, they are not live images. So cervical cancer begins in the cervix and therefore can only occur in women. For those who don't know, the cervix is the entrance to the uterus. It is here marked by the red circle. From a doctor's perspective, it looks like a donut, and it normally looks like this, smooth and pink. The most common and direct cause of cervical cancer is having been infected with the human papillomavirus, HPV, which is a virus that is most transmitted through unprotected sex. Why does this virus cause cervical cancer? Here I made a picture of how viruses work. To replicate, viruses put their DNA in our cells so they can use our cells' machinery as the factory. The DNA of the virus enters and is incorporated into our DNA. As you can see here, the DNA is no longer blue, it has a little red. If you remember, I said that actually the guards I spoke to you about are important genes in our DNA. And when a virus like this does this and puts its DNA into our DNA, it can disrupt those important genes, killing the function of our DNA, or in other words, killing our guards, therefore starting the process of cancer. Since the human papillomavirus is a sexually transmitted disease, this virus has direct access to the cells of the cervix and therefore can cause cervical cancer more easily. In the same way, other viruses or sexually transmitted infections can cause cervical cancer, like the human immunodeficiency virus or HIV, although HIV can also be transmitted through body fluids such as blood. So things like getting a tattoo and a used needle or sharing needles with others can cause HIV. HPV is also not spread through pads, clothing, or using a public bathroom. And sexual activity at any age carries the risk of contracting HPV, especially if protection is not used. Factors that can cause cervical cancer are sexual history, such as having multiple partners in your life or having unprotected sex. Smoking is another factor, having a weak immune system, having had a bacterial infection called chlamydia. There is also evidence that long-term use of hormonal birth control pills increases the risk of cervical cancer, but the risk lowers and may go away after you stop using the pills. Also, a diet low in fruits and vegetables has been shown to be a factor that can lead to cervical cancer, and a family history of cervical cancer as well. Finally, women whose mothers were treated with a drug called DES between 1938 and 1971 have developed cervical cancer and other cancers. There's also evidence that intrauterine devices, or IUDs, which are a form of contraception, lower the risk of cervical cancer. So that's interesting. And you can see here what an IUD is. Now, cervical cancer survival rate is 96% when localized, which means that that's the stage when the cancer cells have not left the area of the cervix and are just in the cervix. But the survival is 56% when it is the cancer is regional, which is when it has spread from the cervix to other nearby areas like uterine and vaginal walls. And the survival is only 17% when it is distant, which is when the cancer has spread. These numbers are estimates, but the takeaway here is that early diagnosis is very important. It is also important to diagnose early because even before the stage of localized cervical cancer, there is precancer, which is when cancer cells start to be shown. As you can see here, there is a precancer stage called low-grade CIN, which is when you start to see a white area on the cervix, and that goes on and on until it is considered cancer. When this condition of low-grade CIN, or at least precancer, when the condition is found at these stages, at this precancer stages, it is very treatable. These women almost never end up with cervical cancer, but once it has progressed to the point of cancer, it is harder to treat. Symptoms do not usually occur when a woman is in precancer stages or in the early stages of cervical cancer, but symptoms that may occur in the later stages are abnormal vaginal bleeding, abnormal vaginal discharge, pain in the pelvic area, swollen legs, urination problems, and blood in the urine. So, the most important way to prevent cervical cancer is to have frequent pap smears. This test is done to look for cancer or abnormal cells in the cervix. For those who do not know, in the examination, the doctor basically uses a paddle and a brush to pick up cervical cells, and this is how they can see if the cells are abnormal. This is a diagram for how the test is performed. Hispanic women are diagnosed in advanced stages more often due to delaying or avoiding pap smear. Now, this may be because of the nature of the test, since it's a little bit invasive, but also because of misconceptions. So we want to clear up some of these myths. Getting a pap test does not harm a pregnant woman or her baby, and medical treatment of abnormal cells does not cause infertility. According to the American Cancer Society or the American Cancer Association, for people who have not been diagnosed with cervical cancer, a pap smear should be done beginning at age 25. Between the ages of 25 and 65, you should have the exam at least 3 times a year, but this is also recommended if you have been vaccinated against the human papillomavirus. So even if you're vaccinated, you should still follow these recommendations. In addition to the pap smear, there are also specific tests for HPV, and these should be done between 25 to 65 years of age, at least every 5 years. But remember, any kind of sexual activity, especially without protection, whether you're 25 or younger, it can still expose you to HPV and therefore increase your chances of developing cervical cancer. Now, in addition to these, there are other ways to prevent all types of cancer, such as quitting or not smoking at all, eating healthy, especially many fruits and vegetables, exercising, and trying to reduce your stress levels. These things can help improve cancer symptoms. If you have already been diagnosed with cancer, it can help prevent cancer. And just in general, it can help improve your quality of life. Finally, we want to draw attention to support groups. Whether you have cancer or are a survivor or a family member of someone who has cancer or survived cancer, support groups can improve your quality of life and reduce your stress. Support groups create an environment of support and understanding. They can help detect and identify emotional trauma by reducing feelings of isolation and loneliness, as it allows you to hear the stories of other people who are going through very similar situations and having similar feelings. They can give hope and self-esteem by allowing you to hear the stories of how other people were able to overcome their situation. Our organization, Latinas Contra Cancer, currently provides the support group service. So if you're interested in knowing more about our support group, let us know. You can shoot us an email and we'll get you in contact with the person that's in charge of that. And finally, just remember that cervical cancer is treatable and curable if caught early. Cervical cancer is not a punishment from God, and it can happen to any woman. And talking about cancer can save lives, so it's important to talk to our family and friends about what you learned today. Thank you so much for attending this presentation or for seeing it, watching it. So if you have any questions, feel free to email us, let us know about any feedback you have or any questions you have. And for more information, you can visit our website, latinascontracancer.org. Thank you so much.